Hello, everyone. It's a real pleasure to have with us today Dr. Jill Crista. And, we're hoping to make this a podcast for you guys as a primer for people who may first be learning about how mold can impact health. Or if you're, first realizing and hearing that you have been impacted by mold. So Dr. Jill Crista is the author of Break the Mold, which is a really amazing book that I just finished. And it explains things so clearly, and it's something that you will see also in all the reviews, and everyone says just how it's such a complicated topic when you first come across it, but she really helps to break it down in ways that are not only very clear, but super engaging. And, I love the pictures that you paint in your mind. And so it's a real pleasure to have you here today.
Thank you so much for having me. It is a real treat.
So before we dive deeper into this whole topic of mold, I thought it would be great if we could first kind of, set the stage for people to understand what is a naturopathic doctor, for those who might not be too familiar.
Yeah, it's a little different depending on what country you're in. In Australia, it's a little bit different than in the States. So how I was trained is as a primary care practitioner who specializes in natural medicine. So I did, cadaver lab, all the gross stuff that you have to do as a doctor. Pharmacology, I'm trained in how to combine herbs and drugs and nutrients, and how to do that safely. So yeah, basically where I was trained in the state of Oregon, in the States, you can go to an MD, a DO, so an osteopathic doctor, or a naturopathic doctor. And that just has to do with what your personal preference is. But we're all trained as primary care doc.
How did you, come to this, find yourself immersed so deeply in this world of mold? And because it's something that, for myself, I experienced, which I've shared on the podcast recently, that I had no idea about previously. And it was, especially in Hong Kong, it was hard to find the answers that I was looking for. And I really had to search, far and wide, and, came across professionals like yourself, which are sharing such important information.
Yeah. So I'm sorry, thunder is going crazy over here. So we have a little, if you hear rumbling. So I started in Southern Wisconsin with my practice as a family practice doc. And it ends up that I'm in a Lyme endemic area, meaning that there's a lot of Lyme disease. We have a lot of deer, we have a lot of ticks, and we have a lot of, other things that are carrying around Lyme or carrying around the tick. And so I was in primary care practice, and usually with naturopathic medicine, when you identify and treat the cause, that's the whole art of the medicine, is really digging and getting to the good diagnosis. When that happens, and I have the hardest working patients ever, and they do their homework, which is usually lifestyle changes, diet changes, moving their body, taking certain herbs, maybe sometimes medication, people tend to get better. And I had this subset of people that just were not getting better. They were doing everything right. And it turns out they had Lyme disease. They had chronic Lyme. And I didn't really understand a lot about Lyme. So I went and got trained through iLads. That's an organization here in the States that's doing more of a functional medicine approach, and really looking at Lyme through the science and realizing this can be a chronic problem, not just an acute problem. And then it's an autoimmune disease. That's what most infectious disease doctors are going to say in our area. So voila. Okay. Now it's Lyme. Now I'm starting to understand how to address this. I give people the antimicrobials, and most people get better. But there's this subset of people that, okay, they've done all the naturopathic things, we've done all the Lyme treatment things, and they were still sick. And again, hardest working patients, 115% effort on everything. So then in one of those patients, they found black mold in his home. And they estimated it was about a 12-year history. And this is a person who had a cancer diagnosis. He kept ending up on the wrong side of the statistics. Chronic tinnitus, ear ringing, we couldn't get a hold of, chronic anxiety, tons of insomnia. His gut was a mess, and he was doing everything right by the books. And so I thought, I if mold is part of this story. And as I went into the research, because when I graduated, I knew mold as mold allergy, which is what the CDC tells us. And maybe sometimes it can cause sort of an MS-like picture. That's pretty much what I left school. And that's even with environmental medicine training. So as I dug into the research, I'm like, oh my goodness, tinnitus, anxiety, pelvic pain, cancer, it was all of these things that this guy was dealing with. And that really opened up the can of worms for me, thinking, I wonder if these other people that have chronic Lyme who aren't getting better, if that's going on for them. And sure enough, they either had a current or a past water damage problem that everybody was saying it's just an aesthetic problem. It's just something you'd paint over. It's ugly, ooh, yeah, mold. We don't like to look at it or something like that. It had really no connection between what was going on in the building and what was going on for their bodies. And that's when I was just like, oh my goodness, we have to address this mold thing. And I started to develop like a protocol, kind of a naturopathic protocol, because every person is different. So you treat everybody individually. And then 10 years later, we had mold in our home. And it was all 3 floors of a nearly new home that they had plumbing issues when it was being built. And it was almost every room except for one room in the entire house had a mold problem. And we didn't know it. It was one of those, as mold does, it was very sneaky. And it just sort of, we just all started feeling a little run down. And my kids, they were going into puberty. And so I thought, maybe this is puberty and maybe I'm going into menopause. And maybe, we had all these things that we were excusing away. And when the flood revealed itself, it was like, oh my goodness, it's mold. Of course it's mold, because it's a great imitator.
Yeah.
Look different in every single one of us, even though I have identical twins. They each had a different expression of the mold exposure, even with the same genetics, because they had different nutritional status, different things going on. And it was just like, oh my gosh, this is mold. And that's when I was just like, I have to write a book about this, because everybody can have the tools that it takes to get better. Sometimes you need medication, but you can do the fundamentals. You can get started on the treatment. And so that spurred the book. Yeah.
And
story.
it's crazy because I think during that time you were actually working on a course for practitioners.
I was trying to, yeah, I know. And I couldn't figure out, man, why do I need a nap every day? I must be really working my brain. Like I had all these little excuses about it. So yeah, I was creating my practitioner training course in this moldy home. And so it was like the mold was telling me, like
got the first-hand experience of it all.
Yeah. Right.
So you mentioned in your book where you talk about its adaptability is its downfall. Could you kind of share a bit more about that? And for example, you say for your twins, it manifested in different ways. Could you kind of paint a picture for people and kind of help them understand how the symptoms looked different?
They look completely different in different people. That's more the rule than the exception.
Yeah.
In families that I'm working with, or that I worked with over the decade before I wrote my book, it was like, wow, this kid has food sensitivities. This one has asthma and ear infections. The mom has anxiety and the dad's irritable and his testosterone is dropping. And it was just like, what? How can that be mold? So that I created a questionnaire for myself in the practice, and I put it in the beginning of the book. And if anyone can't get a hold of the book, I know people are listening from all over the place. Just send me an email at support@drcrista.com. We can send that to you. I also have a link on my website of how to get it. So I created this questionnaire because there I was with kid with asthma, kid with food allergies, mom with anxiety and some hormone issues, and a dad with low testosterone. And I'm like, how am I going to tell? How does any practitioner tell when it's mold? That makes it really complicated. So I went off of my teaching from Lyme disease. Dr. Horowitz created the Lyme MS-IDS questionnaire. And I kind of use that as a model for creating my questionnaire, where things are categorized and weighted a little bit differently based on how much that diagnosis is going to tell us it was mold, and how many diagnoses or symptoms are more, they could be anything, so we just, as it gets closer and closer to mold, it gets weighted a little heavier. And so I just created that for myself in practice, because I wanted to be able to tell these chronic Lyme people that I'm seeing, how many of them have mold, and I was missing it, and try to give a quantitative measure, because I'm very much a analytical based person. And what it ended up being was so helpful at telling us these very random seeming pictures,
Yeah.
organizing it in a way that we can then say, okay, this is mold, even though it looks completely different. And there's some things that sort of, when you think about how mold makes a person sick, it's through the mold spores, the fragments, so dried mold that gets broken up, mycotoxins, which are the weapons I talk about. Mold has bad gas, and also chemicals. So a happily living mold will just be eating and metabolizing and off-gassing. I call them mold farts. It's just, metabolic waste. And these are all different ways that mold can make a person sick. The key is the mycotoxins are the most dangerous because the intention in a mycotoxin is that the mold is trying to defend its territory. So the other ones are just like metabolic, it's just mold farts. It's not really intended to hurt people, but they do weigh us down on our chemical toxin load. The mycotoxins, the intention there is I want to kill this other microbe, and we get caught in the crossfire. So those are the ones I really worry about because of the intention behind it. And they're also fat soluble, which means we can accumulate them over time. And that's really when you start to then think about fat soluble as a doctor, we're not just talking about, booty fat, belly fat, that kind of thing. We're talking bone marrow, brain tissue, coating of the nerves, cells, the cell lining of every cell, the membrane of every cell in our body. We have a fat pad that protects our visceral organ that keeps basically blood sugar balanced and hormone balanced and those kind of things. It goes there. So we do see an accumulation in the body. And when you start to think about all the places I just mentioned, now you understand bone marrow. Okay, that's why it causes immune deficiency. Brain and nervous system, that's why you get anxiety and that's why you get nerve problems. And so then you start to kind of create order around what seems like very different symptoms.
Chaotic, separate symptoms.
Yeah.
And I'd love to dig more deeper into that later as well. But I wanted to kind of, for people who have heard that mold is not something to be not something to be concerned about. For example, a lot of the conversation, which was quite frustrating in Hong Kong for me, was that mold does not affect normal people. Mold or, only affects people who are immunocompromised, for example, those who have cancer. So I'd love for people to understand why they should care about this and how it doesn't necessarily only affect this subset of people, but actually it can affect anyone. And, you mentioned in your book and also from my research, I do know that mold is actually used as a bioweapon. And so if you could share a bit more about your findings, that would be amazing.
Yeah. Yeah. I'm so glad you mentioned that about the bioweapon. That's my response to the person who is in the family who has, like, they're the least affected. They're the ones that say, oh, well, mold doesn't affect me.
It's in your head.
I'm like, yeah. And so it's in the head of everybody else in this family because I'm not affected. I think they're just, being oversensitive. It does affect everybody, period. If it didn't, they wouldn't make biowarfare out of it. So mycotoxins are stored by militaries around the world as biowarfare. And so that's when I tell people, I'm like, it does affect everybody. It's just a matter of dose, duration, susceptibility, which kind of mycotoxin you're exposed to. Some are more disruptive than others. So yes, they affect everyone. And it's much, much more than an aesthetic issue. This is a health issue. And it's rampant in globally rampant, not just because we're building things weird, but because when we do build things to be like the perfect mold farm, which means some of the materials we're using, we build right through a rainstorm, we're using antifungals and paints, we're making superbugs. Those are some things that are happening, but it also gets disregarded, like you were saying. And even construction people, they just, if they find mold, they don't halt and then put up the plastic and do containment and protect themselves. And those were the people that I then saw at the Cancer Treatment Center when I was doing my training there. It was people who were exposed to these sorts of things, over and over and over, day after day, and disregarding the health issues that it can cause.
Yeah. And so how does mold or mycotoxins actually impact the immune system? So it's not necessarily the other way around, but if you have a well-functioning immune system, how does it slowly impact your immune system?
Fantastic. Thank you. That was actually going to be my point I brought up last time, and then I got distracted on my own thoughts. You can become immune compromised by being exposed to mold mycotoxins and mold spores. So the spores induce an inflammatory reaction every time you breathe them in, or you interact with them in your sinuses or your lung tissue. It induces this inflammatory reaction that then the body has to continue to mount over and over and over again. And over time, that gets depleted.
Mm,
And mycotoxins are specifically designed by molds to be immune suppressive, to shut down your body's ability to fend off the spore. That's what the whole point is there, is that it's trying to invade your body. Like my 10,000-foot view is between Lyme and mold. I'm more concerned about mold because Lyme needs you alive to
mm,
survive. So it will just kind of make you limp along in life, but it doesn't have like malintent. I mean, it wants to borrow your body, but it's not trying to knock you off. Whereas mold would just assume compost you. It can do its job better, which, think of mold as just sort of like dopey. I'm just here to recycle stuff, I mean, but it will use these mycotoxins to suppress your immune system so that the spores can get in and infect you, so it can do its job to compost you and make you into nutrients for the planet. So if you think about those two things, like mold spores are inducing and then pooping out your immune system, and the mycotoxins are just full on suppressing so that you get more fungus infection and fungal burden. Now that's how you become the immune compromised person that is affected by mold. The mycotoxins, all of us are affected by them. Our bodies either have to clear them out, pee them out, poop them out. We do have to process them. And for a while, people that are really immune competent can handle that. But
mm,
over time, they will eventually deplete your immune system. And
mm.
then you're dealing with fungal growth and colonization.
Yeah. And then you have also the more susceptibility for other infections and bacterial invasions and so forth,
Exactly.
right?
Exactly. Yeah.
Um,
You really did your homework.
I did. From the whole experience of the past year, and so I only finished. I wouldn't even say finished, but I did my first kind of protocol last month, and so I think I went off it too early though, which you actually mentioned in your book.
Mm.
So not a smart move, which we can kind of talk a bit about more
Common.
later.
Thank
Yeah.
you.
So I kind of also wanted to ask about something that I thought was really interesting of why we don't hear a lot about it in terms of in human studies, and which I thought it was actually crazy that you had to first learn about the impact of mold and health on living beings through animal studies. So could you
Mhm.
kind of talk a bit more about that as well?
Yeah, there's a paucity of research on humans globally.
Mm,
There really is. And
yeah.
really, the conversation, I found plenty of studies on humans when it had to do with spores and spore
Okay.
interactions and
Yeah.
allergies and things like that. So that's why if you go to the CDC's website, which is Centers for Disease Control in the States, their definition of mold illness is what I call spore illness. So
Mm,
there's lots of research on asthma, allergies, allergic rhinitis, non-IgE mediated lung reactivity. And then, so that's there. And then they go all the way down the other spectrum and they talk about aspergillosis of the lungs, which is an aspergillus infection of the lungs. There is a ton of stuff in between there that has to do with exposure to fragments and mycotoxins in particular. And so
mm,
I really want to expand the definition as mold illness is spore illness plus fragment illness plus chemical illness like MPA and VOCs plus mycotoxins. That's the whole picture of mold related illness. But yeah, what you will see is that the CDC really sticks to the spore because that's where we have studies.
mm,
And mycotoxins, there are very, very, very few studies on humans looking at the effects of mycotoxins on humans.
mm.
And I think that there's a reason for that. If we start to really accept that, now it doesn't work for a landlord to just paint over the mold problem. Now it doesn't work for the landlord or the occupational issue if they've got a roof leak to just change ceiling tiles out whenever they get yucky looking. Like that's something that happens a lot in occupational issues. Restaurants, hotels, hospitals, anything with a flat roof, we're ending up schools. We have lots of liability if you start to accept that this mycotoxin thing can actually affect humans.
Mm.
Yeah.
And so, what were these kind of studies on animals and mycotoxins? Like, what did these kind of studies look like?
Yeah. So what was interesting is that if you talk to most mold experts, they'll talk about binders right away.
Yeah.
And that isn't how I was trained. I was trained as a naturopathic doctor. And when I hit the research, a lot of the things that I was trained about detoxification rang completely true here. And that is to move bile. So binders are important to grab the bile once you have moved it. But if you haven't done the step above that and get the bile moving, now you could be binding necessary nutrients and you could be constipating the patient. And I have this little thing, no binders if you're bound up, because so many people that get referred to me on long-term, very high prescription binders, because that's mold treatment,
Yeah.
now having, problems from constipation and nutritional deficiencies, and sometimes just getting off the binder, then they're fixed. It's just very interesting. So the way that what I was seeing in the animal research was they were talking about binders, but it was mainly adding it to feed because they knew they were going to be feeding the animals moldy food. That's a little different from a water damage building exposure where we're inhaling it and it goes into our bloodstream. Now we know the very first thing that we need to do is support the organs of detoxification, because that the path then of the mycotoxin in that case is we inspire it, goes to our bloodstream, and then it takes a split path where it goes either to the kidneys to be peed out or to the liver to be detoxified, and then either peed out as a different form or then packaged up in bile. And that's where the binder comes in. So there's all this stuff on top of that, like the binder sort of the last step that I was trained as a naturopathic doctor that we need to focus on. And the animal research actually bore that out. So in my experience, after reading that and then using this with patients, bioflavonoids are way more important than binders. Like that's helping the whole detoxification process. And then I use things like pre-binders, like cholagogues and things that help the liver. So that's why I talk about things like turmeric and milk thistle in my book, things like alpha lipoic acid. Those are all things that are helping to really pull the organs of detoxification, and melatonin and CoQ10 protect the kidneys. So depending on which way that mycotoxin ended up, we need to make sure that we're supporting the organs with the nutrients they need, but also with bioflavonoids to handle the oxidative damage of those toxins.
Great. And so, for example, just to kind of help people understand a bit more about mycotoxins, and you have this really great image in your book, which people can't see, but you show how the depth that mycotoxins can go and how it seeps through the whole body. So with spores, I believe it only kind of reaches the lungs and you spit it back out. But could you help our audience understand a bit more of how deeply mycotoxins can penetrate the whole body?
I know it's wild to think
Yeah,
that by breathing something, you now have it in your body. Like we
exactly.
just don't really think that way. We think about oxygen that way. But mycotoxins are ultra small molecules, a lot like an oxygen molecule. So that's exactly the same thing that they do is our respiratory passages have an interaction with them, there's no special carrying thing that has to be, some things we have to actually pull into the cell and we have to have little transporters and doorways. Mycotoxins can just gradiently absorb into cells. And so if you're breathing a lot of them, it's going to push the last one you breathed a little deeper into the system, and then your bloodstream will pick it up. So yeah, they go deep, deep, deep into our lung tissue. Our respiratory passages they're so well guarded and they're so smart that we have these little fingers that sort of work up particulate matter up, and then you kind of and then there you go, you just cleaned your lungs and you didn't even realize it because it happens automatically. So the spores get trapped in that goop in our lungs, and then the fingers kind of work it up into our throat, so we just swallow it like snot. We don't even think about it. Or maybe cough.
Mm.
The fragments are a little bit more tricky. They're like asbestos. They can get into the lung tissue and they can lodge into that tissue and really cause persistent inflammation. They're way more inflammatory than the spore. So I always tell everybody, don't do your own DIY cleanup
Mhm. Yep,
because
yep.
that's when we get fragment problems. And there's something, if people are on social media, I have a post about moldothelioma. You know, you always
Yeah.
see these, at least in the States, you see these advertisements for mesothelioma. Do you have mesothelioma? And then it talks about, you know, how to get treatment, whatever. Mold fragments can do that too, as well. They cause this persistent lung inflammation that then causes whole body inflammation just
Mm.
because it's a similar tissue. But the mycotoxins, they can bypass that whole cleaning system and they go down into the alveoli, which are the little air sacs, and that's where we exchange oxygen. And it's also the most blood rich area of our lungs. So if they can get deep, deep, deep that far in, now it can just get carried right into our bloodstream, just like oxygen.
Mm. And it was actually super fascinating to read in your book, and it's a part that I connected with where you talk about how actually your lungs protect yourself, because it's something that I noticed that actually my breathing changed, and I found it more difficult to do deeper breathing, and I found my breathing more shallow. And it's something that, after, kind of realizing and doing the detox with the mold, I'm kind of having to kind of work with at the moment and to improve my
Yeah.
breathing again.
Yeah, your body is so smart. It will actually rewire your brain to underbreathe. Because if the toxin that you're taking in is through air, your smart body will be like, "Okay, we're going to shut that down. We're going to minimize that and just have you breathe enough to survive but not thrive." And that actually happens in the central nervous system. So the
Mhm.
brain just says, "Okay, we're going to minimize how much toxin we take in." And many of my patients have to relearn how to breathe after their
Mm.
exposure to do, conscious daily exercise, like an alternate nostril breathing or something like that, to get that system re-regulated again and to tell
Mm.
the body we're safe, it's okay, but
Yeah.
make sure
Yeah,
you're clean
definitely.
outside.
Yeah,
Yeah.
but definitely interesting, I think, in the sense it's when you do come through it, I think there are aspects where it is a blessing in disguise, because you learn so much more about your body, and you learn
Mm.
how to breathe better. I mean, maybe, for example, I am breathing more shallow now because of my body protecting itself, but perhaps I was doing more chest breathing in the past, but now I understand more of the importance of, how should I be breathing? And when you can also share that with other people, I think that's really great, as well.
Well, like I write in my book, on the whole, when people come to me, what should I take for this or that? I back it up and I say, okay, a body can go without food for about 30
Mhm.
days, water about 3 days, oxygen about 3 minutes. So that's the most important nutrient that we all need. And that's foundation. That's step one. Are you breathing? Because
Yeah.
I could witness it in my patients. They'd be sitting in the room with me and I'd be taking their blood pressure, as we're talking, and they're just like, they're just breathing like down to the first through two ribs of their lungs, and you can visualize it. So I'm like, wow, did you know you can breathe down to your belly? You can direct your air where you need it to go. And it's natural. If you look at children, they're belly breathers. That's just natural. And somewhere along the way, we unlearn that,
Yeah.
especially with mold. Hmm.
Yeah. So what are, some of the common symptoms, or what do the symptoms look like, or for people to kind of get an understanding and be able to say, maybe this is me. And so they can look at it to either find out maybe they do have a mycotoxin problem, or they can rule it out.
Hmm. It's usually not just one symptom. So that's one very important thing
Yeah.
to think about. I'm not Shoemaker trained, but Dr. Shoemaker talks about it as a cluster.
Mm.
Some super common ones,
Yeah.
but unfortunately are common with lots of other things, is fatigue. Fatigue
Mhm.
is very, very common. Dr. Joseph Brewer did a study here on chronic fatigue syndrome patients and those with fibromyalgia and chronic fatigue. And they found mold mycotoxins in the nasal washing of about 93% of those people. So
Wow.
we know fatigue is a really important part of this picture. Also brain fog. And
Mm.
if you think about it, it kind of makes sense. Like we get alcohol from fermented yeast. So when happily living mold is growing in your environment, it's off-gassing alcohol. So you're actually breathing air and getting drunk. And so
I
that's
did
like,
feel tipsy, which you
yeah,
mentioned in your book. It was just such a,
yeah.
I just didn't know how to describe it to people. I was like, I don't know. I just feel kind of tipsy.
Yeah, absolutely. And, visual symptoms or system is very affected, not just the bioflavonoids in the retina because of bile. There's this whole complicated thing that happens with bile in the retina of our eye, but also just the visual processing center of the brain, just like if you've had a drink. I think
Mhm.
that's why we don't drive when we're drinking because you don't see quickly. Things take a little while to kind of process in the brain. And that's that's a really common thing that we see with mold. We almost always see something gut disruption. So that's going to be whatever Achilles heel direction, if it's going to be diarrhea or constipation, or a lot of my patients, they had what one of my patients called constaria. Like, he wouldn't go, and all of a sudden just flush and he would feel exhausted afterwards. Um, Gut inflammation, food sensitivities, losing foods. You might, little by little be dropping foods out of like, oh, it's funny. I don't really tolerate garlic anymore. And
Mm.
that's super common. Not tolerating fermented foods, not tolerating carbohydrates. And so people really love the paleo diet because that's like the keto paleo combination. They're really drawn to it. It's because it's helping to monitor or knock down the fungal overgrowth in their
Mhm.
gut. We see some skin changes. Again, that's going to be your Achilles heel. If you're more prone to acne or psoriasis or rosacea, you'll see more inflammation, eczema, those sort of things. If you're more prone toward aging, you're going to see skin wrinkling, age spots, that kind of thing. So it's oxidative damage with inflammation. It's going to show up on the
Mhm.
skin. We also see a lot of urinary frequency and urinary
Yeah.
symptoms, people
And
that feel like they have
why
a
is
bladder
that?
infection. Couple of things. The
Yeah.
mycotoxins, thinking about the path of the mycotoxin is that's why you get gut disruption because one path is the liver, bile to the gut. The other path is kidney to the bladder.
Mhm.
And the kidneys don't detoxify, they just clean. So those mycotoxins will concentrate in the urine. And when they're there, they're bumping into the bladder wall, and that causes ulceration, irritation of the bladder wall. So you literally feel like you have a bladder infection because there's irritation and urgency. And so there's that. But also, the body, the way the mycotoxins affect the brain, it affects the manufacture of ADH or antidiuretic hormone,
Mm.
which means that water takes the fast track through your body. So you can be drinking water and all my mold patients will say, I can't drink anything until, because if they know they're going to come for a urine test, they're
Yeah.
like, no, I'll drink something in the waiting room because I'll have to pee right away.
Mm.
And doctors, I was trained, that's not possible. But when you've been sick from mold and you don't have this hormone, that's possible. People can drink a cup of water and they can pee 700 milliliters in 10
Mm.
minutes.
Yeah.
So that hormone is really important to optimize when somebody has
Yeah.
been affected by mold.
And so how does mold affect, hormones? And for example, I haven't done this yet, but I'm interested to do the Dutch test panel to kind of see. And you mentioned as well for men low testosterone, that's something that is
Mm-hmm.
common.
Mm-hmm. It
Yeah.
really depends on the mycotoxin. Oh, I should go back. The most common thing when we think about brain and
Yeah. Yeah.
hormones is anxiety or anxiousness.
Mm.
People feel an internal sense of restlessness. Things aren't okay. I'm not safe. And that can look like different things like I don't have enough money. I don't have enough doctors. I don't have
Yeah.
enough this or that. I just don't feel safe in the world. That's a really common symptom that
Yeah.
does get much better with treatment. So the
Oh.
hormones, the reason I was thinking of the brain is that the way the mycotoxins affect the hormones, the bulk of them are affecting the brain regulation of hormones.
Mm.
Some directly affect thyroid and some directly affect testes and some directly affect ovaries. So it just sort of depends on which
Mm.
mycotoxin. They're all really diverse.
It's
I'm
so
talking about
wide
them
ranging.
I
Yeah.
know. Yeah, when you look at the chemical structure of them, it's like, how is this, how am I lumping all of this? But they all do certain things. They all deplete mitochondria. They
Mm,
all deplete glutathione. They all cause inflammation. So there are these, and rapidity of oxidation in the tissue. So there are
yeah.
certain things that's why I put certain things in my book, because even though they're all quite different, there are certain things that all of them do. There's one called zearalenone, and that one is from Fusarium mold, which is typically found in HVAC systems. So
Okay.
that's kind of a new human invention,
Um,
being able to run air inside our home through a unit to make either hot or cold air. There's a reason why this is an increasing issue in homes, because this is a new human innovation, and we haven't adapted that innovation for fungus yet. I anticipate that we will figure out how to do it,
yeah.
because it's really nice to have heat and cool.
Yeah, definitely. Yeah. And
Yeah.
for myself, I found we're still waiting for other results to come back in terms of for the Hermes test. But in terms of mycotoxins, I found four different species, which is aspergillus, but they were all related to water damaged properties. And I think I was, staying in a situation also where the landlord had just painted over the water damage. So I had no idea, didn't
Yeah.
have the awareness. When initially, I think I didn't notice the smell, and afterwards, I just kind of started picking up on little pieces of the detail. And so I had a headache. For me, at least, for the symptoms, I had a headache that I wasn't able to shake for nearly a whole year. And
Mm.
after moving out, it disappeared within 3 weeks.
Wow.
Yeah.
That's
So
impressive. Yeah. Yeah. So, was one of yours Eniatin?
no.
Do you
So I
remember?
think
Okay.
aflatoxin,
Mhm.
um, and aspergillus, something starting with Z, I think.
Zearalenone.
Yeah.
Yeah.
And
Okay.
one more, which I don't remember that one. Probably should.
All
Yeah.
right. That's all right. There are a couple that can go through the blood-brain barrier, and
Yeah.
others can make it into the blood-brain barrier because they cause leaky gut, leaky brain. So they
Yeah.
can, because they're fat soluble and they like the brain tissue, they can
Yeah.
get there. But eniatin and chitomium or
Okay.
chetomium, those two, which makes chetoglobicin, they can go right through the blood-brain barrier. So a lot of people have a headache with those.
Oh.
It's really
Oh,
common.
okay. Interesting.
Mhm.
And it was only on one side, which, I later learned actually can be quite common to kind of just have it mainly on one side that's more affected.
Yeah, yeah. Isn't that wild?
Yeah,
Uh-huh.
definitely. But I do think that that sense of anxiousness
Mhm.
was something that, because I have heard you also mention it's not necessarily anxiety in the way that people thinks, like you're super like tense. It's not necessarily like that, but it's a very quiet underlying sense. And I think I actually didn't realize that I wasn't feeling as bright beside from the headaches, because I think the anxiousness, especially during the time of COVID, I thought, oh, maybe that's normal. And it's normal to feel this way. But it's after I moved out and things progressively got better and I realized actually I wasn't myself then. But you don't
Mhm.
realize it when you're kind of in the midst of it. So it's just quite bizarre.
Yeah, you really described the anxiety feeling really well. That it is quite an inner experience. You look at somebody from the outside and even talking to them, you wouldn't know that that's all happening on the inside, because it's usually, and it can be severe enough they need medication and it goes to panic attacks.
Hmm.
But in the beginning, it's sort of just like it's all happening in the back of their mind, and they bring their to the front of them, to the front, their front facing self is handling it, and
Yeah.
sometimes even they become hyper vigilant handling it, so
Mm.
they're like, no, I'm
Yeah.
good, that kind of thing. And you're like, wow, you're almost like defensively positive, what's going on?
Yeah,
Yeah.
exactly. And one thing I think is interesting, kind of, learning a bit more about the recovery protocols is that actually your body becomes hypersensitive and you kind of have to affect the vagus nerve, and so it's kind of how to quieten that after. Because for me, I think sometimes I can still sense it, but even though I think I feel like it's a normal situation, but I can still kind of sense my body a little active, a little sensitive.
It's very PTSD. Very, very
Mm,
PTSD. Yeah.
yeah.
Because where it goes in your brain, it is the same area where we connect with spirit. It's the same area where we connect with our higher self.
Yeah.
And so when that gets disconnected. Now you have a cognitive brain and a reptilian brain or a spirit brain or whatever you want to call it. They're not speaking the same language anymore because they're out of sync. And so when that area gets affected, you can get really, you don't feel held by the universe. And
Mm,
I think that's the biggest crisis that's happening, is that it sends the message of, not only am I not safe in the world, I'm not safe in the universe. There's nowhere safe for me to be. And reconnecting your energetic or spiritual practice,
mm,
just like with the breath, is
yeah.
so important in resiliency and getting to the
Mm,
point where, and there's some great techniques. There's Annie Hopper's program,
okay.
DNRS,
Yeah.
the Gupta program, which is meditation or mindfulness. There's lots of different ways. We'll use microcurrent, frequency specific microcurrent with
Okay.
patients, just as a machine, that it's like there's a little magic in these machines, I swear. And it
Yeah.
just helps to re-regulate blood flow, nutrient absorption, secretion of this area of the brain that connects us with our higher source. It
Mm,
is as much a spiritual sickness as it is a physical sickness.
mm.
It's an induced spiritual sickness.
Yeah, which I think also I found in my research that actually, mold has been mentioned since biblical times. It's mentioned in the Bible, which you also talk about as well.
Yeah.
Yeah.
And you would have the spiritual leader, whatever the practice was, come, and they would not only physically scrape the mold off the rocks, and if some were too far gone, they would remove those rocks from the house and they would take it to and I'm going to do air quotes so no one can see it, but unclean place outside of town. The
Mm,
reason being, they understood if they just dropped it outside, it would still be affecting the inhabitants of the house and also now their neighbors. So they
mm,
understood it was so toxic, it needed to be taken away from the living spaces. But the second step was then the spiritual leader would come and pray over the home, because they
mm.
saw this as a spiritual sickness as much as it is a body or a physical
Yeah.
manifestation.
Yeah.
Isn't it interesting?
Yeah, definitely. And, also it's so I'm trying to also understand, and there seems to be a lot of different kind of moving pieces, but it seems one, there seems to be a lot more awareness that people might have mold related illnesses. So I'm not sure if it's just because there's more awareness, so people are looking into it. But also, I've heard that with climate change and EMFs and environmental changes. And yesterday, I read this study where a scientist says that CO2 um, actually also impacts greater mold growth. So it seems like it's also becoming more and more prevalent as well.
I think it's going to be on the rise for all those reasons you just mentioned.
Yeah. I was wondering in terms of so how does mold actually colonize the body? And so people get an idea that actually it can colonize your body.
Yeah, you can become the sick building. And
Yeah.
I learned this just working with patients where I'm
Yeah.
like, wait, your mold exposure was 20 years ago in college?
Yeah.
And
So
you're
how
still
does
sick?
that
I
work?
don't get this.
Yeah.
Yeah. Yeah. And what I've come to understand is that it's a continuum. So when you're first being exposed,
Yeah.
all the way to a fungal infection, like
Yeah.
let's say a candida overgrowth or even a fungal vaginitis or an athlete's foot or a
Yeah.
jock itch, we're at that level, or thrush in a
Yeah.
baby.
Yeah.
So that's the continuum of like first exposure all the way to here. And that's going to be very different. How long that timeline is going to be
Yeah.
different for every person
Yeah.
and in their unique situation. If they're being exposed to multiple mycotoxins, which is
Mhm.
more common than not, that's going to move that continuum along a lot faster. So basically, when you get exposed to the moldy air, let's assume, just for assuming sake, all the building material is covering up the spores. So let's just have this be a mycotoxin conversation. So if no spores are able to get into the indoor air, there's going to be no scent because and that's what duped me in our house. Mycotoxins don't have a scent. Mold has to be exposed to the indoor air in order to smell that musty smell. And that's why it's so hidden. So let's assume somebody's in a situation where all the mold spores are trapped behind building material and it's the mycotoxins and chemicals that are coming through. So no stinkiness. Um, Now their body, the respiratory passages, the sinuses are the first thing that get exposed, possibly their skin as well. So if those mycotoxins are coming onto their mattress or their couch or something, when they sit down, they can take it in through the skin just as easily as you get it through the lungs. So now it gets accumulated into the bloodstream. And in the beginning, your body says, "Ooh, this is an icky toxin. Let's make a bunch of bile to get rid of it and cause a little diarrhea." So you have like a loose stool moment. And you might be thinking, "Woo, what did I just eat?
Yeah.
Weird." Or wow, ever since I moved into this house, and you don't
Getting
connect, like,
diarrhea.
yeah. And we started eating from this takeout. So you
Yeah.
associate it with the food because it was a gut reaction, right?
Yeah.
Or you might get a little sinus congestion, or you get a little drippy nose, or dry throat, sore throat, headache, those kind of things. That's the body just saying, like, okay, we're just going to try to do whatever we can do to flush this thing out of the body. Over time, that mycotoxin now the flora of your sinuses and respiratory passage and your gut starts to say, wait a minute, this is a persistent message. And the message in the mycotoxin is, I want to come invade you. That's what the fungus is saying. I want to kill you and take over your spot on the bus. So then your own flora starts to feel unsafe and threatened, and they stop acting like a commensal family or community, and they start going into defensive and shifting into offensive mode. When that shift happens, they get depleted over time. So now you've got what used to be a microbiome, happily living community, turns into a bad guy biofilm where everybody's kind of watching their back, doesn't feel safe, spitting out extra toxin and inflammation just in case. Now the immune system gets depleted over time, and then the fungus can come in and move into those tissues. And if gone on long enough, that's when we get into the fungal infection. But a lot of people get colonized, and that becomes what we call biofilm. And if you look at the research, those people that have biofilm they've done studies of chronic rhinosinusitis patients, so chronic sinusitis, that have to go in for surgery for the Roto-Rooter. When they look at those patients that had biofilm on both scrapings and, where they are testing to confirm biofilm presence, they have worse outcomes from the surgery. They have more infections. They have more inflammation post-surgically. And yet when you talk to an ENT doctor, they'll say, oh no, we don't treat colonization. And I'm thinking, why not? You're going to do a surgery instead of nasal sprays. And when you think about it, their only tool is really high force pharmaceuticals. So they really have to, in medicine, wait until that person is truly fungally infected to warrant using these medications. That's at least the thought process of conventional medicine.
Mm.
In integrative medicine, functional medicine, naturopathic, we have so many more tools. So we can help reset that colonization and reinforce the message, just like we were talking about with the DNRS. We have to reinforce the message to those tissues. You're safe. You can start acting like a commensal community again. Because the whole thing just kind of gets blown out of the water. Everybody gets disorganized. And it's kind of like, it was interesting watching COVID, like everyone all of a sudden was suspecting the other person. Like, hey, are you sick? Are you
Yeah.
the carrier? Do I have to be worried about you?
You're
Ooh, you
asymptomatic.
just tested that handle. I don't know if I can touch that handle now. And, do you have your mask on or whatever? That's exactly what happens in the sinus tissue with your own microbes.
That's a really interesting way of how you kind of linked it together. And so, could you help explain biofilm for people who might not know what it is and why it's important also in the treatments as well?
Yeah, absolutely. So a normal, healthy body has a microbiome, and a lot of us are starting to get educated on what that is. That's just our natural flora. We have lots of microbiomes all over the body. We have a skin microbiome, we have a sinus microbiome, we have a gut microbiome. You're hearing a lot about the gut microbiome, but now we've clued into the skin ones. Of course, the skin people selling skin products want to tell you all about that. We have, there's everywhere in our body, even the brain has its own microbiome, which is
Oh
amazing.
wow, I didn't
So,
know that.
yeah,
Yeah.
isn't it interesting? We used to think it was sterile. So what happens is that when you do get that exposure to the mycotoxins and your own flora starts to act defensively, it starts to kind of hoard nutrients and spit out more inflammation. this creates sort of a matrix. And biofilm is basically can be thought of like a slime matrix where there are bad guy actors that aren't part of our normal flora, or some of them are part of the normal flora, but are taking advantage of the situation of like, hey, while that guy's, you know, attacking his neighbor, I'm going to go in the back door and try to set up shop back there. So like Candida is a classic one to be a biofilm agent. And you get this matrix of slime. And now the guy, all of them kind of, I call it like Mad Max, where they're all competing, but they need each other. And so they do this thing where it's called quorum sensing, where they're protected by the slime layer. Usually they're push Candida to the outside of the clubhouse. Like you go to the outside and we'll let you in every once in a while. And then what do you get on a lab test or a nasal swab? Candida overgrowth, and then everybody says, oh, it's Candida. No big deal, but really it's this other slime layer that is now bigger players like Marcons, like MRSA, which is these antibiotic resistant staph, and you can get Pseudomonas and Klebsiella, kind of bigger actors that are hiding behind this slime layer. And now they will assist each other just enough for co-survival. And they crowd out your own good flora. So in the case of a gut biofilm, what we see with our patients, especially with chronic Lyme disease, they will actually have trouble taking in nutrients because the bugs will feed themselves before they feed you. Whereas our microbiome, when we eat, they metabolize those nutrients into an absorbable form for us. And they eat enough to, help us. We're basically like their planet, But in a biofilm, no way. They just like, thank you. And we don't get as much food. So yeah, that's I hope that's a good description of the biofilm.
Yeah, definitely. And so when they, in terms of when mold can colonize, where are the areas that they tend to colonize? And I know, for example, they talk about the importance of treating the sinus.
Yeah, sinus and gut when it comes to mold.
Yeah.
The lungs also can become a problem, but we talked about earlier, they're very protected.
Yeah.
So it's harder for the lungs to get colonized,
Okay.
but the sinuses are just like this big juicy petri dish that's why, and I didn't always treat the sinuses. It wasn't until Dr. Brewer's transformational study, it was 2013 or 14, when they showed that. So the argument was, well, why are you using, he was getting kicked back. Why are you using antifungal nasal treatment? Everyone's going to end up resistant to these fungi if you do that. So what he did is in the study, they found that if we tested healthy people and sick people with chronic fatigue syndrome, if we tested all of us, everybody would have fungus in their sinuses. So it isn't the mere presence of fungus in our sinuses. We all have it. It's normal.
Yeah.
The difference was when they did nasal washings and tissue samples of the healthy people versus the sick people, the healthy people's were not making mycotoxins. The sick people's were. And that's when I was like, boom, okay, colonization. Now I understand this is a continuum, and that's where I kind of got that theory. When I added sinus treatment to my mold protocol, people got better so much faster. I was like, oh my goodness, we could have saved them years of suffering if we would have just gotten right. And it makes sense. That's our first interaction with mold is through our respiratory passages. So I use the term guard the gates. First of all, let's do that. And then the gut as well, you do through systemic whole body antifungals. And there are lots of really gentle ones that you can do that are hard on the critters and real gentle on a body. And so you don't have to wait for someone to become fungally infected. You can treat the colonization and reduce suffering and time.
So how long does it take for someone to get colonized? Is it like over a period of 2-3 years or hard to?
Yeah, that's a really good question. The occupational studies show, in my personal experience, about 3 to 6 months of a daily exposure. Occupational studies show that is like a coin flip. If you look at where people are getting exposed at their job, now that's not where they're sleeping. So if you're getting exposed where you sleep, that's going to be a faster timeline. But if it's just their job and they're not taking their work stuff home with them, so they do get a break. About 50% of the people, when they get them out of the moldy building and they treat the building, get better just like that. And that's the happy message. It's like, this isn't something that, has to be a life sentence if you have a mold exposure. But 50% of the people didn't. And the difference between the people that did get better and the people that didn't, it's the people that they weren't symptom free when they left the building. They ended up being the people who are colonized. The people whose their body could reset in between the exposure, they weren't colonized and their body handled it. Like their immune system rebooted, their detoxification systems took care of the inflammation. They had enough antioxidants, which is why I use bioflavonoids a lot. Good fats, like the fish oils. Those people that had the right genetics, nutrition, 50% of those people walked out of that exposure and were okay. But the minute that you don't recover in between your exposures, that's when you don't, I would call it, that's when you're colonized.
So the initial recovery is really important initially, that you kind of get it right, especially if you're kind of feeling maybe a bit off, and not just to kind of leave it as is.
Right. And so many people, if it is an occupational exposure or a home exposure, they're like, yeah, I mean, I know I don't really feel so good, but I'm renting and I can't get out of here. And, I mean, those are very real situations. A lot of people, though, when they get the opportunity to leave, mold does some kind of Jedi mind trick that's like, oh, sign another year's lease. It's not that bad, so you start to like convince yourself like, it's not that bad. I just feel a little tired and it's only when I'm home. It's not that big a deal. I feel better when I'm out, when I'm with my friends, when I'm at my job or whatever. You kind of make these excuses. And I've seen patients do this over and over and over again. And I'm just like, listen, you're playing with the timeline here, that you're going to become the person who doesn't get better when you get out of that exposure if you don't get out as soon as possible.
Yeah.
And there are things that, there are situations that it just breaks my heart. There are people who just can't leave their situation initially. But that's where I would rather not spend money on testing and spend all the resources on getting them into a safe space than anything.
Yeah, I think that's really important in terms of, and I've heard it like over and over again, that it's really important for you to remove yourself from the environment. But I had a case where in Hong Kong, which perhaps is a more conventional way, where they said that if the person can't leave, they would just give them steroids to help with the symptoms. That's not good, is it?
No, people couldn't see my face, but yeah, like, no. When you do that, steroids, the number one problem with steroids is fungal infections. They suppress the immune system. So rather than suppressing the immune system, my training would tell us, let's support the immune system. Let's make sure we're optimizing their vitamin D. Let's make sure we're going over the top on anti-inflammatories, things that are going to help control histamine, things that are going to help their detoxification systems, protect those little kidneys. Kidneys don't get enough credit in the whole detox conversation. So do things that are helping to optimize the body's tolerance of that. Because again, going back to that occupational study, like half the people can walk out of there and they're okay. So, and I also use intranasal antifungals, because I just like, okay, continuing to reinforce the message, support's on its way. Let's just get through this. Yeah. And then it's like let's just get through this mode, rather than, okay, we're just going to tell your system to shush, shush, shush. And that's when we end up having fungus truly be able to move in, is with steroids.
So there are two things that I'd love to get your thoughts on. So I guess one is the situation that we're hearing a lot about in India with the black fungus. Love to kind of hear your take on it, and because it's suddenly, you see it all over the news, and how it's, affecting a lot of people who have recovered from COVID and so forth.
Yeah, I think there are a lot of factors going on there. When we look at flu studies with aflatoxin, and that's just one of the mycotoxins that's really common, we do see that it does increase viral replication in influenza. It increases all the inflammatory cytokines. So it basically sets the lungs into a chronic inflamed state, which if you think about what that's doing, increased viral replication, increased inflammation means the body can not only fight the virus, but it can't like calm itself down. And so if you think about it, it was the mycotoxin that led to that inflammatory state. And we hear a lot about cytokine storm with COVID, and it increases viral replication and then hemorrhaging and damage to the lungs. And this is in flu studies. There haven't been any COVID mold studies that I'm aware of. That if we can translate that into similar acting virus, it makes a lot of sense to me that it was probably some mold exposure going into it, and also pollution exposure, which leads to more inflammation. And then you have more viral replication, meaning more ability to damage the lungs under an inflamed state. And now what does fungus do? It says, woohoo, there's no defense here. Now I'm going to overgrow. And so I think that, we see the building practices and a lot more flat roofs and different, things like that are going to increase mold growth on the indoors. But pollution is really key part of all of this. This is why I say in my book, dust with gusto, because the little particulates, that PM 2.5, that's what the mycotoxins are riding around on. So having a dusty home means that you have a higher potential of having mycotoxins in your home, even if your home is in the sick home. Has more potential for having those kind of things that are going to carry toxic toxic messages on the dust.
Yeah.
So I think that's what's going on there, is a combination of sort of mold through building practices, pollution, nutritional deficiency, and then you add COVID and it just makes a lung mess.
Yeah, definitely seems that it seems to be a more complicated kind of accumulation of different factors that create this perfect storm. And so I think definitely, what are the things that you think that we can do in terms of, so one is making sure that our indoor environment we're dusting with gusto, important.
Right.
And so what about in terms of like the humidity in the water? How much does there need to be? Because what I've heard is that there doesn't need to be a lot of water for it to encourage mold growth. Is that right?
Exactly.
Yeah.
Exactly. Just humidity, moisture.
Yeah.
So mold can grow over 50% humidity,
Yeah.
which where I live, that's most of the year.
Um,
It
yeah.
is, I'm in 4 seasons and it's only in the winter where we get lower humidity, and that's if it's not snowing.
Yeah.
So I encourage all my patients to get dehumidifiers,
Yeah.
manage their humidity, and know what every room humidity situation is. You can get
Mm,
these little humidistats at like pet stores and hardware stores, and put one in every room, because the way that houses work, not every room is going to be the same situation. So monitor it. It's a very simple, cheap thing to do. Put a little humidistat not near a window, so you're not looking at what's going on in the outside, and then monitor it and treat any room that is a problem area with the dehumidifier. It's such an easy thing to do, and I get a lot of the dads kick back on, well, that's going to raise my electricity bill, and I'm like, do you want to be here again?
it's
Is,
going to be
is
more
this worth
expensive
it?
after if you have to, deal
Exactly.
with like the damage.
Yeah, or get rid of stuff. And yeah, so if you have a lot of clutter, which is hilarious, I'm saying that because it looks like I have a lot of clutter in my house, but this is like my busiest room. But if you notice, I have doors over my books because I don't like to have to dust my books a lot. And so I seal off my books behind doors so that it reduces the dust. So yeah, there's
Yeah.
just little things that you can do that make a big difference.
Yeah,
But
that's a good
humidity
idea to kind of
is so
seal it off where
important.
you can. So what
Mhm.
about like the HVAC system, like, or people's like air conditioning? Do you recommend they should be kind of cleaning it more frequently? Like, what's kind of your thoughts on that?
Yeah. Yep. It's horizontal surfaces that can't get dust easily. So
Mm,
yeah, it is nice to have those cleaned. It makes a lot of sense. And in our area, the inspector that I work quite a bit with, they're finding a lot of Stachybotrys, which is the toxic mold,
mm,
in the furnace coils. So I would say making sure to have a dehumidifier and making sure that the near your coils, and then that your furnace is draining. A lot of times we'll see the pan kind of back up, and a lot of HVAC, they they kind of put the tube sort of along the floor. They don't really tilt it at all. So I've had in my own house, I go in and I like pick the tube up a little bit and try to get it so it's like draining and drain bleach down it and that kind of stuff, just to make sure everything is staying as dry and moving as possible. So having your dehumidifier near your coils really helps. And
Okay.
they would say clean them often. The problem with that is until last year, maybe the year before, there's only one manufacturer that's making removable coils. Right now, they have it behind the Freon, so you
Mm,
have to have an HVAC person come out, discharge the Freon, take the coils out so you can clean them, put the coils back in, recharge the Freon. It's a mess.
yeah.
But they've gotten sued enough now. They're making the coils removable for cleaning. So I think that that's a good
Smart
change.
move.
That's kind
Yeah.
of policy change we need to see.
Yeah, absolutely. And a bit off topic, but I was wondering if you could actually share some of your case studies and stories, your stories that you've treated in the past. And so, for example, I thought the hockey player, I think it was, I thought that was
Mm-hmm.
interesting because it wasn't his home. It was just, somewhere where he practiced his playing hockey.
Yes. Yeah. So I had a young guy who was a hockey player. He was like the big stud, and he
Yeah.
kept injuring himself and ended up with neurological problems. And that, he'd gone to everybody, chiropractor and massage and physical therapy, and he just kept having this stinging nerve pain that actually took him out of the game. And it turned out their locker room was incredibly moldy, and he had pads that brothers had had before him. So he was one of the few people that didn't have like newer pads, and the pads were completely moldy. So every time he would put his stuff on to go play, he was getting mold mycotoxin exposure. And they would kind of like joke about it, like his pads were the funkiest ones. Like, oh, you don't want to put your stuff by his
Yeah.
pads, they just stink. And here it was that's what was making him toxic. And he had skin rashes where they were. And, again, you just kind of, especially athletes that kind of blow that off of like, yeah, it's just from rubbing and whatever,
Yeah.
it was actually the pads.
Yeah, but that's crazy. It was only like a few hours per day, right? It's
Well, it was like four. I mean, they
yeah,
practiced quite a bit. Yeah, 4 or 5 hours a day, day
yeah,
after day. And then he would go in to do extra shooting practice and
yeah,
all of that. Yeah. But
yeah.
and our skin is incredibly absorbable. So
Mm.
the mycotoxins can go right through the skin. And
And
I
you
think of
mentioned,
like baby bath toys, that are
yeah.
moldy, and you're putting your baby in that water. It's like, oh my gosh, the skin can take in so much.
Mhm.
So yeah.
And you mentioned the hands and the feet are more sensitive as well.
They absorb. So
Uh,
one of the ways that we get medicine into babies that can't swallow if they're breastfeeding is we can put herbal compresses and tea on their feet, and we can get it into their
um,
system. Isn't that
okay.
crazy? So yeah, the hockey player had um, not just his pads, but his hockey shoes. They were handed down from brother to brother, and he got the mold.
Yeah. But actually, I think one thing people don't really, maybe they might not know is that antibiotics are actually from mold. Could you
Yeah.
speak to that a bit? Yeah.
Yeah, a lot of antibiotics are synthesized from fungus. And that's something that a lot of people don't really understand. And when you think about that, the whole thing of the piece of bread and that's where we got penicillin is from the penicillium mold growing on bread. We didn't actually get the mold. We got this little sterile ring that was on the outside of that, which is where we didn't find any bacteria. Because again, the intention of the intention of mycotoxin is I want to kill all other living things. Of course, it's just going for like bacteria and fungus, but we get caught in the crossfire and it's just as damaging to our cells as it is to those cells. So
Yeah.
yeah, many of our antibiotics, I'm a Lyme treating doc also, and we have to be kind of careful if we know the building exposures. If we know there's aspergillus and penicillium
Yeah.
in their building, I do not use any of the penicillin drugs because I know they're going to have a bad reaction. I go for the
Um,
cephalexin and things that are going for from a different fungus.
yeah. So if it's the antibiotics one, it's almost like you're inhaling antibiotics on a daily
Yeah,
basis, right? And I
yeah,
don't know how that wouldn't
exactly.
affect your immune system.
Totally. And that's always the gut problems because you get basically dysbiosis from
Mm,
what you're inhaling, which is
yeah.
just kind of like, brain blow. That's a lot of people are like,
Yeah.
what?
So I still don't understand why people are like, no, it doesn't affect the immune system. It only affects certain people. And so, as you mentioned, it's just a matter of dose and timing and your particular situation at that time. And whether
Yeah.
or not you remove yourself and you kind of make sure that your body is getting the support that it needs.
Absolutely.
Um,
Hmm.
what about in terms of like how mold can impact pregnant women?
Mm.
Um,
Yeah, I am the most strict with pregnant patients of anybody,
mm,
because we see that mycotoxins can bioactivate in utero, meaning they're bad in our bloodstream, but they get even worse when they get into the placenta and into the baby. So I'm very, very, very strict with avoidance. Like they're the ones that have to get out of that building. They need to go stay with a friend or something like that. Like they cannot be exposed. And we also see that there's some prevalence of the male dominance in autism with mold exposure, and
mm,
also PANS. We're saying that mold and PANS, which is pediatric autoimmune neuropsych syndrome, that autism and PANS, so neuroinflammation is a very high risk. And that's when we're developing our nervous system and our immune system
mm,
is,
mm.
during pregnancy. So yeah, it's just too risky. You don't want to be affecting that kid's whole life by saying, yeah, but I like my bed, or, I don't have anywhere to go. And it's like, find a place anywhere, find a shelter or something. Like you need to
Yeah.
get out of the mold. I'm very
So
strict with
it
pregnant women.
bypasses into the placenta and it gets worse in.
Yeah.
That's crazy. Yeah.
It's crazy. I mean, I kind of vilify mold that, it's this big evil thing. Like I said, it just wants to compost you.
Yeah.
But if you think about it, like the intention of those toxins, when intention is everything, right?
Yeah.
Like we're all energy. Intention is everything. And if mold is spitting out that mycotoxin, the intention is to harm. And that's just not worth the risk when you're pregnant.
Yeah, definitely. So all the mamas listening out
I
there,
know.
or the family members.
Just freaked everybody out. It's just not worth it, and also doing some preconception planning. If you know mold has been in your
Mhm,
history, making sure that you're detoxifying is really important. Because one thing
mhm,
we do see is that sometimes moms who go into the pregnancy kind of toxic, the pregnancy itself can be really stressful, or if they have a lot of morning sickness and they're not able to eat a lot, and if they
mhm.
lose weight, they will release this toxin. And so they're basically, exposing from the inside. So doing preconception planning is super important. And it only takes like 3 to 6 months. You can do this detox and get it out of the system.
Okay, yeah, that's great information, and I think super
Mhm.
helpful for people to kind of have this awareness. Um,
Yes.
I wanted to kind of like ask about like for example, for me, like I think I've become a bit of a canary, and um, after I moved out of the previous place, I went to look at a different apartment, and after I went in, so the apartment is new. It's like 3 4 years old. The building, it looked spotless. It looked super clean, and I asked whether or not there had been previous, water damage. Um, but so no water damage. However, I noticed that I had that sensation of feeling tipsy again. And it
Mm.
was just so weird because I was like, oh, but you guys haven't had any water damage, and I confirmed it. And then everyone else thought it would be fine. But I was like, all right, let's test this. Let's get an Hermes test and let's see if we can
Good
find it.
for you.
And
Yeah.
it came back with aspergillus. And it
Yeah.
was just crazy. And I think it's kind of, as you mentioned in the book, it's so important to listen to your body. Yeah, because
Yeah.
you,
Especially there. I mean, that's such a confirmation of just like, okay, my body is telling me it's not, something's not right. And that's such a confirmation to have that lab test, just to be like, yep, I can trust myself. And
yeah,
that's a really important thing to do. And that building might be fine for somebody who's never been made sick. The level of aspergillus might be controllable. It could have been in the HVAC system. So they
mm,
didn't ever have to have a spill
yeah,
or a water damage or a flood, just enough humidity. And then those furnace coils can concentrate it. And, I mean, that can be how it happens. Aspergillus is very commonly found, but it's
mm,
not healthy. Like
yeah,
that's one of the problems that I see with the remediators, because they're forgetting they have a selection bias. They're getting called into buildings that have problems. They're not testing every building, like it's not like we're taking a random sample of healthy and sick buildings. So their bias is, oh, all the places have aspergillus and penicillium. And so it's like, no, 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 that's you need to realize that's your bias for the selection of those buildings you get to see. And
Mm.
they both make mycotoxins that are carcinogenic. So just because it's commonly found doesn't mean it's healthy.
Yeah, definitely. And as you mentioned, it's a matter of like how long you've been exposed for it as well. Maybe your body can handle it initially,
Mm-hmm.
but then that kind of slow degradation, which is I think of what I had experienced.
Mm-hmm.
And so in terms of, we spoke about energy just before, and I think I heard this in a different interview that you did where people can actually become moldy buildings themselves, right? But what about for the canaries? Like how sensitive can you be? Because I think, in the past, sometimes when you sense maybe the field of energy being kind of off and maybe you think it's something energetic, but now I'm thinking actually maybe your body's sensing mold in that person. Is that possible, or is that just too sensitive?
No, I think that that's quite possible. I mean, we see this with PANS kids that they know that infection is what tripped the trigger. Like the antecedent state was that they had immune deficiency, and then they got
Yeah.
an infection and it just trips the trigger. They become very good barometers for people who are either getting sick, so are brewing a cold or brewing a strep infection, or are sick or that kind of thing. They get very avoidant of the people that they know are going to make them sick. And it's a brilliant wisdom rather than calling them kooks.
Mm,
We should be like, oh, you're listening to your body. Your body knows that it needs to guard itself from more infection or you're going to have a flare. We really honor that. And we find that the kids have a lot less flares. So I think there is something, just like how they're using dogs for COVID sensing now, for people that are carriers or that are brewing an infection but haven't shown the symptoms yet. They're starting to do dog sensing. I think there are chemicals that come along with those cytokines that we are sensing those, and we have that ability. And by engaging that right brain side of ourselves, we can really protect ourselves.
mm,
Their discernment is everything, though, because you don't want to necessarily be the person who's like, oh, I think you're a problem. Like
yeah.
you want to make sure that you're also like
Bodybuilding.
not being in this like limbic overdrive. The world is not safe. I don't have any safe place to be. I think the discernment is really important. So repetition sometimes is the thing that you're going to need to experience of like, it's weird. Every time I'm with that person, I get exhausted. And,
Mm.
and it isn't because they're an energy vampire or anything like that. It's like they need treatment.
They need a mycotoxin test.
That's right. Yeah.
Um, so I was wondering, like, for example, how long does it usually take to calm the limbic system down, and how long do you kind of see that kind of? Is it a year or a few months or?
I don't know. I'm not seeing that in my patient population as severely as maybe other people are, probably because we do address it by
Mm.
using a really integrative approach. So we're
Yeah.
using acupuncture, using, supporting a exercise practice that's also a spiritual practice like a
Okay.
yoga, or
Yeah.
using microcurrent. So I think because I have a lot of those kind of things,
Uh,
homeopathy, I'm not really seeing as much of the looping as I'm hearing about. It's
okay.
kind of becoming something a lot of people are talking about, the limbic system and the
Yeah.
vagal dysregulation, polyvagal theory. And while I think that really is a major part that needs to be addressed, I feel like I'm probably addressing it. And so I
Uh,
guess the message there is address it.
yeah. Yeah. So
Yeah.
if people are interested in microcurrent, like what do they look for? What is a therapy called? Is it just called microcurrent therapy?
Thank you for asking that, because there are lots of uses of that word that aren't the same thing. So a TENS unit is technically a microcurrent treatment, but it is one frequency of one tissue. So it's just trying to hit the nerve and managing pain.
Mhm.
A frequency specific microcurrent, and that's what I'm using. And you can look up information on frequencyspecific.com. That has a range of uber amounts of frequencies that you can choose. And you can run mold frequencies, tissue frequencies that are specific to where you're having the mold or mycotoxin problem. And I don't poke that bear until I know that we've done all the homework. We've done the protect layer and the
Yeah.
repair layer. then we might poke that bear, but I might be using it earlier for supporting the liver, supporting the kidneys, supporting the gut, supporting inflammation, reducing anxiety. There's lots of things that you can do to. So having a frequency specific microcurrent practitioner is just like, it's just an ace in the hole for you because it's so flexible and it's magical. Truly.
Yeah, it's so
There's something.
interesting.
Yeah. It
Yeah.
has been shown to increase ATP production in cells, and that's a big deal for mycotoxins.
Yep.
We see mitochondrial deficiency, and then people don't have enough
Mm,
cellular
yeah.
energy.
And
Mhm.
are there certain vitamins that you see are depleted more because of mold exposure? Like, for example, like vitamin D, which we know is also really important for fighting, diseases as well. And so I was
Mhm.
wondering, do your vitamin D become more lower with mold exposure? Like, are there certain vitamins?
Yeah, you were just reading my mind. Vitamin D, mold actually blocks vitamin D receptors in the body.
Oh,
Yeah. Isn't that wild?
blocks
It's
because,
just
okay,
again, it's like that Navy SEAL, right? Like what is going to keep the person hormone balanced and immune sufficient?
vitamin
Vitamin
D.
D. What does it block? Vitamin D.
Wow, it blocks vitamin D.
Yeah.
They're like, I mean, kind of look, I kind of admire how resilient they are
I
in a way.
know.
Like just they're really survivors. They're such troopers. I mean,
I know, truly. I was joking with my partner. I was like, I'm going to come back as a mold. So I'll have a good long life. I'll have all this information about bodies that I can.
yeah, have a whole army. My gosh.
Yeah. Yeah. So vitamin D for sure. And
Mhm.
then bioflavonoids like vitamin A, D,
Okay.
all the things for immune. So the ACEs, vitamin A, vitamin C, vitamin E, vitamin or zinc, not vitamin zinc. So those are the anti-inflammatory antioxidant base.
Yeah.
Everything else kind of works off of those. Yeah. But vitamin D is a biggie. If I see the people there, they're down in the 20s,
Yeah.
like over years. Like you've been sick with mold for a long time.
Yeah. So they need to be getting out, getting some sunshine, but also supplementing with vitamin D.
Yep. Yeah, because it's blocking the receptors, you do kind of need to flood the receptors. In my experience, and I know
Okay.
different doctors have different opinions, but I boost the vitamin D to try to get them to the level of 60 to 90 nanograms per milliliter on their lab.
Yeah.
And that I'll
Okay.
try to hold them in that range for like 3 to 6 months until we can get those receptors working again. It
And
does raise MMP9, which
okay.
is correlated to histamine.
Yeah.
So for some people, I have to do things like, holy basil or quercetin or DHA, the things that we know lower MMP9 at the same time so that we can ratchet that dose
Oh,
up.
okay. So it's like all that balance, but it's definitely, I think that's why it's so important that people find a practitioner that they can work with who is mold literate. Which I really want to mention that you actually do have a course that's a medical level, right? For practitioners who
Yes.
want to learn more about mold.
Yes. Yep. I stopped taking new patients to the chagrin of many new patients so that I could take some time to train more practitioners because we need more mold literacy out there in medicine.
Yeah. So besides from your course, do you also offer sometimes online workshops for practitioners like that they could kind of tune into as well?
Yeah, I'm just starting to offer some case review meetings so they can just sign up for a workshop and we'll go through some cases. They can submit cases and then we'll go through, how to get through all of this this
Yeah.
process.
Yeah, I'd love to definitely share more with any practitioner actually, but
Yes, yes, I would love. Yeah, thank you. And then I do have a membership because after writing the book, I got so many people that wanted to see me as a patient and didn't have a mold literate
yeah,
doctor anywhere.
yeah.
So we have people from all over the globe. I have a membership where they can pick my brain. I try to get on every day and just sort of like, address questions. And then we have a Q&A, a live Q&A that they can attend a couple times a month.
Okay. And what is the website for that for people who are interested?
Yeah, that's drcrista.com, drcrista.com. If you just go to my membership page.
Okay, perfect.
And we
And I'll
talk about
share, yeah.
mold and Lyme, talk about mold and histamine, mold and pans. We're expanding it a little beyond just mold canaries because we found out that, like once you have mold, you have lots of other stuff, autoimmune disease,
Yeah.
MS, dementia, that kind of thing. So yeah.
Great. And I'll share everything in the show notes as well for everyone, just in case they missed it. Yeah. And so, what are some things that you find that are really important that people might miss that hinders their healing journey? Like, what are maybe top three things that they should 100% not be doing?
Not be doing. I take people off fermented foods and
Mhm.
mushrooms, cheeses,
Okay.
yeasts, anything like that. Even medicinal mushrooms in the very beginning,
Ah, okay.
because the message in the mycotoxin is fungus wants to come in. So
Yeah.
we don't want to add more fungus temporarily
Mhm.
so that that message doesn't get reinforced. So that
Ah,
would be the big thing.
yeah.
And then getting outside every day. So
Yeah.
do not be a couch potato. Remember, mold wants to compost you. So
Yeah.
if you are feeling like, oh, I'm just too tired, because I know how that feels when you're sick with mold. I mean,
Yeah.
it takes a lot of willpower to get your butt up and get out. And even if you need to just go for a drive, assuming your car isn't moldy, but get out and get outside. So the don't do is don't just stay in that environment as much as your body says to stay. Fight that
You
as
actually
much as
say
possible.
move more, right?
Move more. Yeah.
Yeah.
Which is tricky. We make natural EMFs when we exercise. People
Mm.
don't realize that. Like, not all
That's
EMFs are
fascinating.
bad.
Yeah.
So when we exercise, we make EMFs intracellularly. But if you're being, mold makes that harder to turn over into ATP. And so that can feel really uncomfortable and more fatiguing and more pain and inducing. So the more that you get out of your environment and the more that you move in a gentle way, the more you're moving all of those things and oxygenating your tissues.
Mm,
Yeah. And
okay.
then it's not really a don't, it's a do. Veggies, 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 veggies.
Yeah. Okay. Plenty of
Vegetables are
veggies.
the way out of this. Yeah.
Yeah. Do you have any
Mhm.
favorite ones that you like to go to, or is it just a matter of diversity?
Yeah, I think the Brassicaceae family is pretty well founded in how it helps detoxify many of those different types of mycotoxins. It runs through sulforaphane, runs through these different areas of the liver. So that's the broccoli, cauliflower, kale, Brussels sprouts, mustard greens. That's one of my favorites is Indian sag. Oh, it's so yummy.
Oh, okay. Haven't tried that. Have to
It's
give that one
so
a try.
well. When I was really sick, I was like, it comes in a can. I didn't have to do anything. I could just open the can and dump it over some chicken or fish or
Yeah.
something and throw it in the microwave. I was like, this is all that's going to happen today. And it really reduces pain. So
Yeah.
yeah,
Okay.
pain and
Awesome.
inflammation is one of my easy. Yeah. And
Yeah.
then beets and things that are good for the
Okay.
liver. So beets are fantastic for some people if you're oxalate sensitive, since you've gotten,
Yeah.
if it's really colonizing to the point of fungal overgrowth.
Mm,
Oxalates can be a problem for some people, so beets can be hard.
okay.
There's lots of other things you can eat. Like parsley is one of the lowest oxalate greens, and the apigenin in parsley is like magic for mold. So yeah, those are some of my faves. But
Okay.
color, 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 color.
Color. Okay. Lots of color. Great.
Mhm.
And so even for example, like you mentioned, like the medicinal mushrooms, like there's um sometimes coffees where they it might include like a mix of like
Yeah,
coffee,
like reishi coffee.
yeah.
Mhm.
So that's something that they should steer off as well.
I have people get off all of those, anything with fungus in the beginning,
Yeah.
because it just reinforces the message that fungus is coming. That's my patients taught me that. I mean, I didn't initially do that. I'm a big fan of medicinal mushrooms. I
Yeah.
started at cancer treatment centers. That was one of the like nice things, like you could really, for solid tumors, we knew that that would make a difference. But no, when I did that, a lot of people ended up with aggravation in the tinnitus or
Mm,
couldn't sleep. And so I was just like, I wonder if that's the mushrooms. And when I took them
yeah.
off, then those things improved
Oh,
a little
okay.
bit. I mean, it's
Yeah.
all the little
Yeah.
things.
Yeah.
We don't want to
So-
add something that's going to make things worse.
Yeah. So the ear ringing and you mentioned the pelvic pain is also something where once you hear those symptoms, you start looking for mold.
Yeah, those are some of the oddities of mold that I'm like,
Pelvic
ooh.
pain, yeah, that is quite odd.
Hmm.
Yeah.
Yeah. And it makes sense. I mean, the mycotoxins, if they take the kidney path,
Yeah.
concentrating in the bladder, and they're lipophilic. So they're just, if you're holding your pee, they're
Yeah.
just going to kind of seep into the nervous system of that area. And
Mm,
then they just ping, 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 ping the nervous system. Same thing in the ear.
scary stuff.
I know. I
Um,
know.
And so like, what about, for example, like brain recovery? Like, for people, since brain fog is quite common, like
Mm,
what are the things that people, for example, besides from supplementing with fish oils, like what are things that you think really help with brain recovery?
definitely fish oils.
Yeah.
Yeah. So the idea of the solution to pollution is dilution.
Yeah.
And that is if you have a fat soluble pollutant,
Mhm.
you need to dilute with good fats and lots of them, and then moving those fats with cholagogues, things that move bile. And resveratrol has been very profound for clearing up people's brain fog.
Oh,
It's
okay.
just
But not
been
drinking wine, not that way.
no, right. The amount of resveratrol that you need in a day is the equivalent of 60 bottles of red wine.
Oh, wow. Six.
So, yeah, that's when you want to supplement. That's right.
Okay.
Yeah.
Okay.
And then green tea really helps with brain
Oh,
neuroinflammation.
okay. And
Mhm.
also coffees, right? Do you recommend only drinking mycotoxin free like
Yeah.
coffee? Is that
Yeah, coffee is a great bitter. The better bitters are going to be the greens
yeah.
because they're providing nutrients, but there are plenty of people who are coffee bowel dependent. And if
Mm,
that's the case, if that's going to get things going and move bile, go for it.
okay,
Yeah.
great. And so for example, like, I think in the modern age, like, with the diet that we're on, sometimes it's quite common to have some minor gut issues or, to have leaky gut. In that case, how do you go about in terms of your strategy of treating people? Like, do you treat the gut first or do you treat the mold first or both? Like, how do you kind of think about what approach to take?
Yeah, this is where I go to food and herbs because
Yeah.
they do multiple things at one time. Um,
Um,
I love aloe for the gut. It's very soothing. It's high in these polysaccharides that are going to boost the immune system, and it also binds mycotoxins. So
oh,
it's like boom, 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 boom. We have all these things that are happening with aloe. Yeah, I have. It's one of those. I think of that as a good binder because it's nourishing and it's soothing and it's doing more than just like grabbing something and taking it away. Also, cabbage. Cabbage is in the
oh.
Brassicaceae family. It's very high in butyrate. And butyrate is the favorite nutrient of our enterocytes, the cells of our gut lining. So it's another one. It's very soothing and you can juice it, you can cook it, and it's providing a lot of those sulforaphanes that are helping with detoxification, but also nourishing the gut.
And so for aloe, is it what kind of form? Is it like in the supplements? Like
You can
what
do
kind of form?
the studies on binding were when they superfine ground it and concentrated the polysaccharides.
Okay.
Um, and then, but the soothing can happen with even drinking aloe juice.
Yeah. Okay. Okay. Great.
And then if you're constipated, you get the aloe, the whole leaf, because
Okay.
the outer part of that leaf is a laxative as well. So it's just like, if diarrhea is your problem, make sure you're just doing the inner part
Okay.
of it.
Okay.
Most capsuled aloe is just the inner part.
Okay. Okay. And actually, I thought it was one thing that was interesting as well is that you mentioned how actually in indigenous cultures, like they knew about mold and how to treat it, but it hasn't really been passed down. So could you kind of share a bit more about that?
Yeah, they knew how to prevent it better than anything.
Mm,
Because they would, like in the Pacific Northwest in
yeah.
the US, that is super rainy, very humid area. They would build with cedar on the inside of their huts.
Mm,
And cedar is one of the best antifungal essential oils. And so that's the whole like they would build it to be a mold safe, kind of drafty, already spitting out essential oil, mold safe home. So I think that's the biggest thing is that if you look at indigenous cultures all around the world, if you look at how they built their living environments,
mm,
they were unique and specific for not only what they had available, but also for them to be the most health promoting structure. And
mm,
that's where we've really gone wrong.
yeah.
We've gotten into this efficiency thing in the 70s where we closed up all these homes. And so we concentrated humidity, and we're using materials that are already pre-digested. Mold loves it.
Yeah. And I
Yes,
think
thank you. You did the chewing for me.
yay, just a little bit of watering, and then we're all good to go. But I
Right.
think, yeah, the building practice is so important, and which I think we'll have to like get you on the episode again, on the show again, to talk more about this, because I feel like this is another like whole hour of, the whole kind of remediation and the building practices and everything as well.
Yeah, I'm not really a building expert. I'm a body expert, but I
Yeah.
can recommend some people that are really good.
Yeah.
I love Mold Finders Radio, Brian Carr. He has a Mold
Okay.
Finders Radio, and IEP Radio with Michael Strantz.
Yeah.
They're just a wealth of information. And it's like, you wouldn't want your remediator to treat your
Mhm.
body.
Yeah.
Same thing. Like I know enough to be dangerous, probably.
Yeah. And actually, before I forget this, but do you have any favorite books you like to gift or recommend people? Doesn't have to be mold related. Maybe one can be mold related, but maybe like 2 or 3 books you love to share that we can kind of direct our listeners to.
Yeah. So some things that are pertaining to mold and detoxification is Dr. Ben Lynch's book, Dirty Genes. It is a wonderful book. It goes through like the really common gene SNPs that get in the way of detoxification or histamine reaction. So he gives you an idea of like genes can either be too fast or too slow. And
Mm,
so that can look like 2 different pictures. And then what do you do about that, to help either speed it up or slow it down? So I love that book. My colleague, Dr. Darren Ingalls, wrote a book, The Lyme Solution.
mhm.
And Dr. Nicola Madfadzian also has a Lyme book. Because mold and Lyme travel together a lot, it's nice to have those resources, because if you do start your mold treatment and you're like, oh, I actually have Bartonella also, which
Mm,
is what we just discovered in our membership. Like 3 of the people were like had hidden Bartonella that showed up as they got healther from the mold, which is really interesting. So those books are really nice, because if you do find yourself in that situation where you have the 2 of them, then those are great resources. As far as preventing Lyme, there is a Lyme prevention book out there, also from a colleague of mine, and I'm blanking on her name. Got Alexis Chesney. There it is. I knew if I just took a deep breath. Yeah, Dr. Alexis Chesney. And then there's a recent book out on mold and Lyme together, written by Dr. Diane Mueller.
Okay.
She's a naturopathic doctor in Colorado, and she wrote that with her partner. And it is just a wonderful, it's all about the mindset.
Mm,
So, and they just had a summit, the Body, Mind, Mold, and Lyme Summit. So that's another resource for people if they want to check that out. So those are some places to go that give you kind of all the things around mold.
Okay, perfect. Great. Thank you
Yeah.
for sharing that as well. And finally, kind of because aware of like your time as well. And with like your testing, so we have like the urine testing, and what kind of testing do you recommend for people to do? But also, if they want to track their progress, what kind of testing should they be doing?
Yeah. The questionnaire is really the nicest for the tracking, because so many people will forget how bad they were.
Yeah.
And, they'll come in and they'll be like, oh, Dr. Jill, do I have to stay on these antifungals? Do I have to still do my nose thing? And I don't think I'm really getting any better, those kind of things. So, and then we sit down, we look at the last questionnaire they filled out, and they're like, oh,
Actually.
yes, that's right. I had migraines. And I'm
Yeah.
like, you forgot you had migraines?
Yeah.
So, mold brain is a real thing, guys. So that I have people fill out all the time, so that we can really track how they're doing. And we can also see when there's a new exposure, because things get really bad, and really bad, even though we're doing all the right things, in air quotes, all the right things, and they're getting worse.
Mm,
It's time to go looking in the building again.
uh,
So I do use urine mycotoxin and serum mycotoxin testing, depending on what's going on with the person. And when you take my doc course, I have a chart that's ever growing based on split sample testing that I do to just test and see we want to know which is the best test in which situation.
yeah.
And then that's just a data point, so if they've done a serum test, that can take, if it's positive, that can take 6 months to normalize.
Mhm.
So if you want to retest sooner than that, you can do a urine test. And then we look at other things like normal things that insurance covers, like a CBC, liver panel, I'm looking at vitamin D. I'm kind of tracking all of those things too.
Okay.
If somebody is really not doing well immune wise, we can run a natural killer cell function test. It's pretty expensive, but I do love it, because it's mold is one of the few things that'll lower that function. And it's a way for us to know how robust we have to be with the immune part of this protocol.
Okay.
And then just a simple VCS test, which is a shoemaker test, visual contrast sensitivity. It's really cheap. You can do it on survivingmold.com or vcstest.com. It's like $15.
Yeah.
And that's where I will run that when somebody is really central nervous system affected.
Okay.
And I'm trying to track how, we're always trying to minimize supplements and things like that on people. So if their VCS is bad and their natural killer cell function is good, now I know, okay, the focus needs to be nervous system support, not so much immune support. And so it's a way to kind of figure out where we need to go. And so now after I've run a ton, now I know, but
great. And so for the nervous system support, like how would that look different compared to, is it just a change in terms of what kind of supplements?
Supplements, maybe what microcurrent frequencies we're running, maybe what homeopathy we're using.
Okay.
Maybe they need to do certain types of exercise that are going to be engaging both sides of the brain. So if they're a tennis player, I say, okay, I need you to go do something that's bilateral. So yeah, just those kind of they're little things, but they're profound. If we can be seeing what's going on.
Yeah, which you also mentioned that we shouldn't discredit, the everyday herbs that we use as well, because they can be incredibly powerful. And it's not, the more stronger it is, the better it is.
Yeah, like if it comes from far off in China, like your patient you were talking about, it's like, I had to travel really far for it. And then you're sitting there in the kitchen and sprinkle a little rosemary on potatoes and put some garlic in there and not realize that's mold free. That's an antifungal that you just made your potatoes antifungal. So, there's a ton that we are using every day. Because we use it every day, we discount the power. And familiarity kind of, decreases the power. So yeah, when I open my herb drawer, I'm like, hi friends, I always invigorate my spices. Yeah. I'm like, you guys are amazing.
Yeah. Definitely.
You don't realize it. It's not just about flavor, things like basil, cinnamon, clove, sage, these are all things that we add to food. Rosemary, that are flavorful, but there's a reason why they taste good. And people will notice that they start craving certain foods and flavors as they get sick. And then as they get well, they're back to sort of a balance. Yeah. So our flavor can be really potent.
And actually, you mentioned the essential oils. And so like with cedar, do you recommend people diffusing like essential oils, as part of healing and also as part of prevention?
I like the waterless ones because they're not adding to the humidity issue. Just, the good old fashioned bamboo stick in a closed mouth bottle and it'll diffuse the essential oils. That's a passive diffuser. There are others that are more active. Yeah. If you're EMF sensitive, don't have that right by your bed because that does emit EMFs, but you can have those water-free diffusers, you bet.
And how long do protocols usually look like for people have like an idea if they maybe haven't been exposed for that long? How long does how long do they need to be doing supplements? I think the retesting is 6 months.
3 to 6 months. I will do the first retest at 3 months because I want to see if what we're doing is working. Yeah. Any sooner than that, I don't recommend because things get uglier before they get better commonly. Like we'll see MPA go really high and we'll see other mycotoxins show up. And then the person's like, wait, I'm doing everything right. Why am I sicker? And I'm like, your lab looks worse, but you're not sicker. So that's where it's nice to have the questionnaire. Typical, I would say, that's always hard to say because I have my own selection bias, but I would say it's average that you're going to need to be doing something for your health for 2 years before you really feel like you get your body back.
Wow.
Yeah. Fungus is tenacious. That's one of the things. It's once fungus takes hold, it does not have the same life cycle as a bacteria. Bacteria can divide in hours. Yeah. Fungus will wait around for the opportunity. And most antifungals are working when the fungus is trying to grow.
And so what supplements would you recommend people, say, for example, take long-term that definitely if they've had exposure?
Totally individual. Yeah. Totally individual. Yeah. That's hard to say.
Yeah. No, I thought so. Yeah.
Yeah. I put a lot in my book and I try to put doses so people really understand like what's a safe dose and that kind of thing. But I don't take people off antifungals until we get a 0 mycotoxin test. Because if you think of it, the fungus is the fire, the mycotoxins are the smoke. If they are still having mycotoxins and we're doing detox and we're doing antifungals,
Yeah.
those mycotoxins aren't down to zero. And people do have zero tests. Like that's not,
Mm,
that's a healthy test.
yeah.
When they're down into zero or, normal range, then we slowly wean away the antifungals and then we retest again. And if it starts coming up again, nope, we're not done yet.
Yeah. So antifungals are like a mix of like oregano or like oil of oregano and so
Yeah,
forth.
that's a heavier hitter. That's a
Yeah.
big one.
Yeah.
Yeah. So we might use that initially, but then kind of wean them off to where they're just taking a little bit of time. Maybe some, like I have a product that has like all the spices
Yeah.
and some bioflavonoids. This just like kind of keeps a lid on things. And then we withdraw that and then we see if the mycotoxins stay away.
Okay, great. And is there a particular diet? So you mentioned paleo before. Is that a diet that you would recommend people kind of stay on?
It's tricky because you do
Yeah.
need a ton of vegetables.
Mm,
Vegetables, and that's the colorful part of food. The bioflavonoids are the colorful pigments. So I do see a lot of people just go on like a meatitarian diet, and I don't think the carnivore diet is going to be as beneficial as something where you're doing, good quality protein and lots of veggies.
okay. Okay.
Then maybe cut out the greens,
Yeah.
but some rotation of grains so that your microflora, your microbiome gets a little bit of what it likes.
Okay.
But it can be
Yeah.
easier than we make
Yeah.
it.
Great. Thank you so much for all the information and a lot for
Yeah.
everyone to digest through as well. And so is there any interesting, research or literature that's kind of coming out from this world of, molds that you find interesting or anything interesting that you think would be cool to share?
A lot. I don't even know where I would start.
Yeah.
Now that it is hitting the radar a tiny bit, we are seeing more human studies. And so,
Oh, okay.
I'm in the research every day and just like, oh my gosh, I need to make a post about this, or I need to email my doctors about this, or, whatever. So yeah, there's a ton. I wouldn't even know where to start. I think something really powerful for people. I'd
Mhm.
love to have empowering things and
Yeah.
things that people can do themselves. The fact that natural killer cells are the branch of the immune system that get depleted with mold, and that's one of the few things that can do it.
Mm.
Doing things that boost natural killer cell function is really important. And one of the most important and profound things that does that is forest bathing, Shinrin Yoku.
Mm.
It's not just being out in nature, but the appreciation of it. So if you can't get outside, like during COVID, people couldn't get outside. I said, get a house plant and love on it.
Yeah.
Appreciate the heck out of it.
Yeah.
If you can get outside and there's just one tree in your neighborhood, go lean
Okay.
back on that tree and love that tree, appreciate every part of it. And they find that if you can do that for 20 minutes, it was more powerful when you actually get into, a park or a forest. But
Mm.
20 minutes of appreciation, not just being with, but appreciation, boost natural killer cells by like tenfold over the next couple of days. Like it's a huge effect.
Yeah.
So, and I think that whole gratefulness practice, like I've had a gratefulness practice I didn't realize that's what I was doing until people like talked about it and kind of defined it for me. But I was like, oh yeah, gratefulness. I know that. And so I think gratefulness, that's a very empowering and vitality inducing practice that has nothing to do with what you put in your mouth, has nothing to do with like a gadget. It's just you being in nature, which is where we came from in the first place.
Yeah.
Good old nature is my favorite.
Yeah, definitely. And I was saying this morning, before our call, I thought I'd make good use of the time and could do a little bit of grounding and a little bit of tree
Love
hugging.
it. Yeah, love it. You just boosted your NK cells. Woohoo.
Uh-huh. Yay. And so for people who want to, find you and want to see what you're up to, where's the best place for people to find you? Like Instagram, and we have got the website. If you could kind of
Mhm.
share that, that'd be great.
Sure. So the website is drcrista.com. Again, that's drcrista.com. And I'm on Instagram, Facebook, and YouTube. I do lots of frequent short videos because I remember from Mold Brain, a minute or less, like true Instagram fashion, little nuggets of information and then little pearls of wisdom cards and, that kind of thing. So, and you can subscribe to my YouTube channel and you can get on my newsletter list, and I have more detailed information, things that I'm sharing, like how to get a hold of things that rebalance your ADH. And I just sent one about this whole craziness in the States with N-acetylcysteine and the FDA. Sent a message to my newsletter list about some of the other options that might work for mold. So just those kind of things. If you want to get on my list, you can email me and hop on.
Sounds great. And it's not just about, treating diseases. And I think it's also about, overall health and wellness. And I think all this information is super helpful, even for people who want to just stay healthy and kind of want to improve their understanding of how overall health and well-being.
Yes. Yeah.
Thank you so much again.
Thank you. Yeah, this has been great. We went over a lot of stuff. So yeah, perfect. I hope we help a lot of people.
Absolutely.